Everybody, it's Dr. Ewell again from Action Chiropractic. Hey, I just wanted to give you a short video on low back pain, a couple of the causes. We're going to do the big causes, disc problems and facet joint syndrome. So the first one we're going to talk about is the disc. So a lot of people hear about disc herniations, disc bulges, and it can, if they do have a disc bulge or disc herniation, it can be a very serious and painful episode. So first of all, the disc is made up of a cartilaginous shell and then kind of a liquidy, spongy nucleus pulposus. Sometimes when that disc ruptures, it'll put pressure on that nerve that sits in between each one of the vertebrae. So the disc is not a very movable material. It's kind of like a ligament, and the disc, it doesn't like flexion and rotation. So if you flexion rotate, picking things up, that can cause a lot of tearing of the disc. Now the disc doesn't automatically just tear all of a sudden. A lot of people will have lower back pain for years and years and years. Every day they'll have some pain here and there, and one day they'll go and pick up a piece of paper or pencil, and then they can't move, and it's a debilitating injury. And it doesn't. So it's not that episode or that picking up that pencil that caused the disc to rupture. Is the straw that broke the camel's back, but it's been happening for years and years in micro amounts of time of trauma over time. So that hard outside shell eventually will rupture and cause that disc to herniate. So, and then it'll put the pressure on the nerves. Typically it causes pressure down your lower back and all the way down your legs. And coughing and sneezing can bother it. I use this analogy right here. This is a normal curvature of your spine. You want to lift properly by bending your knees. If you lean forward without bending your knees, it puts pressure on that front part of that disc. And the disc is kind of like a balloon. You put pressure on that front part of that balloon, that disc is going to bulge back and start putting pressure on that nerve. Eventually it's going to tear. So that's one of the main reasons for lower back pain or causes of lower back pain is disc herniations or disc bulges, and that can be prevented by just lifting properly, sitting properly, not bending and twisting. If you could do that, you'll save a lot of pain. So the second thing I want to talk about is facet joint syndrome. The facet joints are the posterior joints on the spine. So the front part of the spine has the vertebrae here. The space in between each one of the vertebrae are the discs that we just talked about. But on the back of the spine, you have these posterior joints. They're called facet joints. They're synovial joints. Sometimes when you have an extension injury or just plain extension of the spine, it'll put pressure on those joints back there. So women that wear high heels, they're forced into that extension. That can cause a lot of localized lower back pain. Also sports injuries, people got hit from the front, like football injuries, they get hit from the front, kind of bends them over backwards. It causes that posterior joint to compress, and that can cause lower back pain as well. So another cause of lower back pain is being overweight. Having that posterior pelvic tilt will cause the posterior joints to, or anterior pelvic tilt will cause the posterior joints to compress. And then also being pregnant, some women or women that are in gymnastics, they have that high arch or that arch, increased arch of the spine. So those are a couple of causes of lower back pain. Chiropractors work with the disc problems, facet joint syndrome, and we've had really good success on treating patients that have those problems. So if you do have any of those problems, you want to give us a call. I'd be more than happy to take a look at you, see if I can help you. All right, thanks a lot.